What do you wish people understood about your role in healthcare?
What do I wish they understood? That if they have chronic issues, that there is hope for them,
Mm,
and people like me and other functional medicine practitioners and health coaches can help, and they don't have to continuously keep going to the doctor and be told everything looks fine, and then go back home defeated. And that's where I was, defeated and just feeling like there was no hope for them.
it's really interesting to hear you say that because what you're talking about is the emotional and psychological side of having a chronic illness, which
Hmm.
you may lose hope and the feeling like I'm never going to get better. There is no hope. Nobody
Hmm.
hears what I'm saying, or there
Yeah,
is no treatment for what I'm going through. And
yeah.
so, your example of patient centered care is to say, let's look at the entire patient. And this is something we address the health needs, but in addressing the health needs, it also gives the emotional and psychological support, which is so valuable and
Hmm.
necessary in
Yeah.
what we're talking about. So, excellent. What excites you about the future of healthcare?
Okay, this is a fun one because my sister goes to that same OBGYN clinic, and she had appointments last week with her OBGYN and her PCP, and both of them were talking to her about functional medicine because she
Mm,
was telling them, well, this is what my sister told me, and they're like, yeah, I think your sister is like spot on. And I think and the reason I use that example is because the more I'm talking to other healthcare professionals and like in this world, and the deeper I get into the functional medicine world, the more I see conventional doctors, nurses, health coaches, all of the above, any sort of practitioner in that area are recognizing that there needs to be a change. And I think that change is slowly but surely coming. And I always say that working in tandem with Western medicine and functional medicine, like right in the middle, is like the perfect mold of healthcare. And I feel like we're moving in that direction. It's just slowly but surely, but we are moving in that direction. So that's exciting.
yeah, what you say is that they're not mutually exclusive. It's not like you have to go the conventional route and eschew anything that is non-traditional, or that you
Mhm.
have to go the non-traditional route and jettison everything that is more conventional, that the two of them can coexist, and
Mhm.
in doing so can provide a broader range of healthcare options and healthcare treatments that really do meet the needs of the patient. Have I properly summarized that?
Yeah, no, I think that's exactly right. I like to tell people that the Western medicine world is really, really good at acute healthcare,
Mm,
and the functional medicine world is really, really good at the chronic side of healthcare.
mm.
And we all need both at some points in our life. And so when they work together, it's a wonderful thing.
Okay, so your answer to this previous question kind of makes me wonder if I already know what the answer to my final question is, and that is, what is one thing medical professionals can start doing today to improve the quality of healthcare?
Okay, my big final answer is to just be patient-centered and stop worrying about the time that they're sitting in there with somebody, or going in with the mindset of just throwing a medication at somebody. I think if we really were more patient-centered and patient-focused, healthcare would change massively and drastically.
Okay, and because you were talking about the fact that your husband had leukemia,
Hmm.
sometimes I feel like being family centered as well, realizing that
Hmm.
the patient, we talked about a holistic view of the patient, but understanding that the patient doesn't exist in a vacuum, that there are relationships and family members and a broader group of people that are affected by this diagnosis. What are your thoughts to being not just patient centered but being family centered as well?
I think that goes into being patient-centered. That's something we actually have, like a holistic health wheel that we kind of follow, and
Okay.
relationships is actually one of the big pillars of functional medicine. We want to know how your relationships are, and oftentimes, like even like when I meet with clients, I typically want their spouse to meet with us at least in one of those meetings, or,
Okay.
their caregiver, or whoever that main support person is, because we obviously in the functional medicine world, we feel like that is extremely important. And so to answer your question, I think you're spot on with that, that relationships play a huge role in it, and it's very important.